Not all low back pain is equal. In our low back, we have a whole bunch of muscles, tendons, ligaments, joints, discs. We have a lot of supportive structures that are holding up our body weight, allowing us to move. It's allowing us to develop force to squat, lift, pick, turn, and twist. So there's many different types of tissue and places that things can get injured. And when people have chronic low back pain that always comes to the same spot, they keep hurting the same zone because there's weakness in the system overwhelming that tissue that didn't completely resolve, and they're going to keep flaring that up over and over again till they solve that problem. So low back treatment is really going to depend on what did you hurt, how did you hurt it, how long has it been, and how much strength, endurance, and flexibility do you currently have. We're not just going to stretch the hamstrings and saying that's all the pain. Your hamstrings are compensating for that low back. It's trying to stabilize the pelvis by pulling on the bottom to keep the pelvis steady. Well, you're never going to fix that hamstring problem until you fix that core strength. And you can't fix the core strength unless you're doing the right type of exercises and stretches to build that stability, build that neurologic control so you're stabilizing the spine. That also may involve changing some of your habits and postures. We might have to work on those ligaments, those supporting structures that hold bone to bone. Many times people have muscle and tendon problems, as in they have little pain sources throughout those tendons that every time those muscles contract, or they're doing an exercise or activity for an extended time, they always flare up that same zone. That's an area where we have to get in, break up that problem area, get it to heal. We usually have some hip tightness or hip flexor tightness. We're having to stretch and loosen up. We might have to combine Graston Technique, advanced muscle therapies, or a low-level laser to decrease that pain and inflammation. We have both traction in the intersegmental kind with a big roller that's rocking those joints to provide motion and movement, or especially for arthritic joints. Or we have decompression therapy that's pulling those joints apart, increasing that joint motion, bringing more blood flow to that disc. The specific exercises and stretches really depend on where you're weak and what you need to do. We might refer you to pain management so we can buy some time. If you decrease that internal joint inflammation, it'll allow us to help repair and heal faster. We might end up needing an ablation therapy, something that's really blocking a lot of the pain, so you can step back and go through this therapy correctly. So low back treatment is going to depend. It depends on who you are, what you've done, how much structural damage you have, and what do we need to do to get you better, and how strong you currently are. We provide many of these options, or we work with specialists who provide the more advanced techniques, but at the end of the day, we have to get your core strength where we need it. We need better flexibility to get those joints to move as well as they can with the greatest amount of joint stability and control.